Hi.
Hi,
Hi, can you start by tell us what's your name and what do you do?
I'm Linda-Gail Bekker.
Yeah.
I'm a professor of medicine and an infectious diseases specialist. I am the director of the Desmond Tutu HIV Centre and the CEO of the Desmond Tutu Health Foundation. We're based in Cape Town, South Africa.
Yeah, perfect. So you have dealt with a lot of cases in Africa and mostly in Kenya with that deal with these infections, one of them being that is HIV and AIDS, yeah? And why you are holding this particular conversation is basically to understand how people are using medicine, especially those that are related to HIV and AIDS, persons living with HIV and AIDS, yeah? Africa, we saw like Donald Trump, one of our major donors in Africa for these particular medications, also said that there will be a cutoff for it, yeah? Before we get to that deep conversation, would you tell us, according to your statistics and data, which are the most used medicines and medications when it comes to the prevention and also in terms of managing the infections of HIV and AIDS here in Africa?
So there is a medication for HIV called antiretrovirals,
Okay.
and there is a selection of these that are specific for treating HIV. And there are around 39 million people in the world today who need to use those medications every day to stay alive. So that's important. Aside from that, though, for the last 10 years, we've known that we can combine those one or two of those antiretroviral treatments and use them as prophylaxis to prevent HIV. So this means somebody who is not living with the virus takes these antiviral agents in a single pill called PrEP, and that stops them getting HIV if they use it consistently. So oral PrEP is the first very important kind of concept.
Yeah, I wanted to ask, yeah, because you said like when they're used consistently, they prevent. Does it mean like the more you use it, the more the more immune you get to this particular infection, or what do you mean by the consistent, or the more you use this particular medicine? What do you mean by
So,
that?
in order for the PrEP to work, it needs to be in your body and in your tissues when you are exposed to HIV. So it's important now the medicine comes out of our bodies every day. So you have to take a new pill every single day to keep the levels in the body high enough that you actually are protected when and if you are exposed to HIV. So we're talking about sexual exposure, and because people aren't always sure when they're going to have sex, we suggest that they take the pills every day to protect themselves if they are sexually active.
So that means you can be exposed, but when you take the PrEP, you can be able to wash it away in your body. Is that what you mean?
It actually protects you from getting infected in the first place. So it blocks the virus coming into the body right at the sort of front wall, if you like. But it's important that the drugs are on board in order for them to work.
When you're exposed to it. Yes. So there have been a lot of cases, especially even here in Kenya. Let me speak from a Kenyan perspective because Kenya has seen it, where you have had a lot of sex workers who have been told and perceived, and not only maybe sex workers, maybe other people, maybe in other areas, maybe I'm not aware of. They have been accused of misusing this particular medication. Is there such a thing as misusing this particular medication, or you can always use it any day, anytime? Can you say that?
I think like any antibiotic or any medication, you should use it the way it's been prescribed. And so your clinician, the person who suggests you should use it, will tell you how to use it. But generally it's one pill every day, and that's what we recommend for people.
Oh, so that is the recommended, What are some of the side effects when you overuse this particular PrEP? Maybe you use it twice or thrice a day. Just to get our audience to understand that this.
We don't recommend that you use it twice or thrice a day, but if people do by mistake take more than one pill, that's not going to be dangerous. The side effects of the pill are very infrequent. Maybe 1 in 10 people will see side effects, and usually they wear off. So you have side effects for the first month, and those are mostly very mild, bit of tummy bloating, maybe a little bit of diarrhea, but it settles down and then people use the pills without any problems at all.
Yeah, is it available only in pills or is it available in other forms?
So beyond the oral PrEP, the pill PrEP, we now have new agents that have come about. The one is the same kind of antiretrovirals in a vaginal ring. So this is a monthly ring women insert in their vagina, and the antiretrovirals are diffuse out of the ring in the vagina for up to a month, and then a new ring has to be put in. And then the last innovation that has just come about is injectable PrEP, which is in the form of a 2-monthly injection called cabotegravir, and that has to be injected into the butt every 2 months. So that might be something that men can also use if they don't want to swallow a pill every day, can get an injection every 2 months to prevent HIV.
Yeah, is that why you came up? Is that the reason? The main reason? Why is the main reason that you came up with the infection, the needle one? Because was it the pill one most effective, or is according to how people preferred the ways of receiving medication?
So we have found that the injectable PrEP is more effective, but that's probably only because people were more likely to have it on board. Because it's given as an injection, you don't forget to take the injection, and so the injection is always there. So we found very good effectiveness, but the oral pills, if you use them every day, are as effective. So all the medications are very good as long as they're well used, and we now recommend that people actually make a choice based on their preference. So do they not like needles, then they might want to go with pills. If they worry they're going to forget the pills, they might want to go with an injection. And women might prefer a ring because that way they don't actually have to swallow anything or have an injection. So it's going to depend on the individual, and for the first time now we can really talk about choice for prevention.
So according to your data, because you are based in South Africa but you work all over Africa, can you tell us what is the data in terms of the distribution of this tablet? How far are we in terms of the distribution and making accessibility of this particular medication to the African people?
So we've had oral pills for the longest. That most of our countries have now approved oral PrEP, and that is really available just about everywhere in Africa. People may in some countries have to pay for it, in other countries it's free, but it is available. The vaginal ring is also been approved in many of our countries in Africa. It's a little harder to get because our governments are not necessarily buying it, but donor funding agencies have been making it available, like the Global Fund. The injectables are far less available, and these are not yet completely approved everywhere, although a number of countries are now approving cabotegravir long-acting, the 2-monthly injection. There is a 6-monthly injection which has just been shown to be effective in clinical trials, and we're waiting for our countries to approve the 6-monthly injection. So the injections are still quite hard to see and to get in Africa, although we hope that's going to ramp up soon.
What are some of the challenges that you are facing in terms of now passing these particular medications in these African countries? What are some of those challenges that you are facing?
So cost is huge. So especially when these new drugs come along the first time, they're very expensive. So we've been relying on government, on donor funding from the US government or from the Global Fund. Of course, we've just heard that the US funding has dried up. So that's a big worry. And these medications, when they're new, are often too expensive for our own governments. But what we are really pushing our governments now is to think about whether they can fund these, because we think this can really make a difference to the epidemic. and help people protect themselves.
What about the reception? You know, because a lot of African countries and people have engaged with you before medication, before they take it, before they have trust in terms of taking that particular medication, especially with a very delicate infection such as the HIV. You know, people are very skeptical. Yeah, how is the reception? Are people receiving it?
Yeah, you know, I think we also have to create awareness and demand. I think people do want to protect themselves from HIV, and I think people want knowledge, and I think if we give them good information, plus they see others, early adopters, who are using it safely, it's making a difference to their lives. People tell me that are using oral PrEP that it's taken all the anxiety that they might contract HIV away, and that is worth a lot, right? That you don't have to worry about the risk of HIV infection is huge. And so I think, like everything, we have to get into the communities, create awareness, use these kinds of opportunities to get the word out, and to make sure that people can make choices for their own well-being.
Yeah, and so you present some of other medications that people can be able to access. Yeah, maybe I don't know if they are less or more effective than PrEP. Can you maybe give us tell us more about them and be able to tell our audience about them so that we can be able to.
There's more than just PrEP for prevention, right? We've always relied on being faithful to one partner, testing with your partner. We've always relied on condoms, male condoms, female condoms. We also know that voluntary medical male circumcision is very important in our male populations. We know that if we, go regularly for testing, and if our partner is positive with HIV, if they take their antiretrovirals and they become virally suppressed, in other words, if the virus is no longer detectable in their blood, we know that they can't transmit HIV anymore. That's what we call U equals U. So these are all the other things we can be doing and offering to people so people can choose the prevention method that works best for them.
Actually, I think even PrEP should be like the last option that you take to.
I don't think necessarily.
Okay.
I think people should be allowed to choose whatever works for them. And when I go into a country that is malaria, and I come from a country that doesn't have malaria, I can choose to wear long sleeves. I can choose to spray my skin with insect repellent. I can choose to go under a bed net at night, or I can take an anti-malarial prophylactic agent. It's up to me to choose what I want to do, and that's exactly what we should do with HIV.
Nice one. So as we come to a conclusion, could you tell us what is your call for action as we come to a conclusion?
I think the call for action is that primary prevention is absolutely key for Africa to bring HIV under control. We need good treatment, but we also need good prevention. And people need to be testing frequently, and if they test negative, they need to say, what is the right prevention method for me? And then they can choose from the whole menu that includes pre-exposure prophylaxis to say, what am I going to use for myself at this time? And it may be that in 6 months' time, I want to do something else. But at this time, what is the prevention method that is going to work for me? And that's what we need every single African young person on this continent to do.
That is all about prevention. Let me ask you this final question. I was supposed to ask you way before, but I want to know, because PrEP has taken a long time before we are able to find it, and that's a prevention. How close are we to finding maybe the cure? Because you are a doctor, you are in the research facilities, you can tell us, give us hope, or do you still have hope? How far are we in terms of finding the cure?
I think we have changed our thinking around cure. What we are now aiming for is long-term remission. So what that means is I will take some treatment that might include a vaccine, it might include antiretrovirals, it might include a broadly neutralizing monoclonal antibody. This combination will make the virus in my body so low that I can actually stop treatment and find myself in a remission.
Wow.
But a bit like cancer treatment. Some people, they have their cancer treatment and the cancer goes away. We don't say they're necessarily cured, but we say they're in remission. So I think that's what we're really aiming for now. But the cure work is ongoing, and we believe that research should happen right here on this continent. But until we have the cure, it's important that people take their antiretroviral treatment every single day as prescribed.
Yeah. Thank you so much, Doctor, for talking to us.
Thank
and
you.
God bless you. It was a nice moment. Thank you.
Thank you. Thank you.